Now discussing about the adenomatoid odontogenic tumor, okay, also called adenomaloblastoma. This is a benign tumor and this is odontogenic tumor. It's a benign epithelial tumor of odontogenic origin. It is embedded in the mesure connective tissue stroma. Okay. At first, what is the adeno? Adeno means colon-like structure lead to the formation of the duct. This is epithelial tumor. Besides, it's embedded into the connective tissue stroma. The growth of this tumor is slow but progressive. That means it develops gradually. It is considered as a hematoma rather than the tumor because of its limited size and lack of recurrence. That means we know that tumor grow excessively, but this tumor not have no such growth. This tumor slowly grow, and this tumor have lack of recurrence. That means return of disease after a period of remission. Okay, आफ्टर रिमिशन के बाद ये डिजीज़ रिटर्न नहीं होता है. सो दिस इज considered as a hematoma rather than the tumor. Hematoma also it is a malfunctional cyst. It is less frequent than other odontogenic tumor. It is also known as two-third tumor. Why this is called two-third tumor? Because two-thirds of this tumor occurs in young women. Two-thirds of the tumor occurs in the maxilla. That means maxilla is to mandible 2:1. Is two-thirds of the tumors of this tumor associated with the unerupted teeth. That means erupted teeth and unerupted teeth ratio 1:2. That means unerupted is to erupted teeth 2:1. Among affected teeth, two-thirds of them are canine. That is most effective or impacted teeth is canine. Now we are discussing about the histogenesis. That means origin. Theoretically arise from enamel organ, epithelial lining of the dentigerous cyst, and third number is epithelial rest of molluscs. Fourth number is remnants of dental lamella. We already discussed about these two, molluscs and dental lamella, in the squamous odontogenic tumor. This tumor also arises from the epithelial lining of dentigerous cyst, so may be confused with the dentigerous cyst radiographically because there is a corticated border in both cases, dentigerous cyst and in this tumor. Now clinical features. As younger than 20 years, people have mostly occurred in this disease. Sex. In case of female, these disease occurred more than male. Location. Maxilla 65% and mandible 35%. That mostly in anterior teeth. Anterior and posterior teeth is 2:1. Maxilla mandible also 2:1. We already discussed. The measuring size of this tumor is between the 1.5 to 3 centimeter, and when the size of this tumor is in between 1.5 centimeter and 3 centimeter, this is asymptomatic. That means no symptoms seen. If it exceeds 7 centimeter, then we see the swelling, and this swelling resulting into the facial asymmetry or distortion. Peripheral lesions is painless, present as a gingival mass. This gingival mass size 1 to 1 centimeter in diameter. This gingival mass 10 times more in the maxilla than the mandible. That means more seen in maxilla. And this gingival mass more seen in case of female. That is female and male ratio is 14:1. Discuss about the clinical differential diagnosis. That means they share similar signs and symptoms, but they are different disease. Okay. After this differential diagnosis, central odontogenic cyst or tumors, benign fibro-osseous lesions, benign mesenchymal neoplasm. Okay, that means these three diseases share the similar signs and symptoms with this tumor. That means adenomatoid odontogenic tumor. Gingival lesion clinically similar to, that means the gingival lesion, that means peripheral lesions of this tumor. Gingival lesion clinically similar to fibroepithelial polyp, peripheral cemento-ossifying fibroma, odontogenic fibroma, amyloblastoma, COC, that means calcifying odontogenic tumor. COC means calcifying odontogenic cyst. Radiographic features of the adenomatoid odontogenic tumor, which is unilocular radiology. And this unilocular radiology exhibit a smooth corrugated border, and this is similar to the dentagerous cyst. That means we may confuse with the dentagerous cyst in radiographically. So at first we discuss about the what do you mean by unilocular and smooth corrugated border. Okay. Unilocular means one compartment. Here you can see that a room like a structure. It is one room like a structure that is surrounded by a border, which is corrugated border. This corrugated border is smooth. Now, what is a corrugated border? There is two type of border. One is corrugated and sclerotic. Corrugated is sharp border, and sclerotic border is a thick border. So here is the border is sharp. So this is a corrugated border, and this border also present in case of the dentagerous cyst. Actually, both sclerotic and corrugated border both are opaque curved line. Actually, here it is the corrugated border. You can see here the figure. Are pericoronal or juxtacoronal. Okay, that means pericoronal means, suppose this is crown, and that means pericoronal. This is a crown, this crown, and pericoronal this surrounds the peri means surrounding. That is pericoronal means surrounding the corona. Okay, it is surrounding the crown of the tooth. Okay, surrounding the crown of the tooth. The cyst will be in the surround the crown of the tooth. Or juxtacoronal, that means about to close to the crown. That means maybe here. That means close to the this crown part. That is the juxtacrown. So cyst may be in the pericoronal side or the juxtacoronal. That means may surround this crown or about to close to the crown. Diameter is 1 to 3 cm. That means 1 to 3 centimeter, but radiology extend apically beyond the cemento enamel junction on at least one side of the root. That means diameter 1 to 3 centimeter maybe, but radiology, that means a empty space. Empty space means there is a tumor and extend apically towards the root side beyond cemento. There is a cemento enamel junction, and this radiology may cross the CSC. That means cemento enamel junction. At least maybe one side or maybe in the both side. This is crown, this is root. Cemento CEJ, cemento enamel junction. Cementum means covering the root. This is the enamel. Okay, that means root may be in the. That means cyst may be seen here, pericoronal, juxtacoronal from outside. But when we see the radiography of this tumor, we can found that any one side of the tooth towards the root side at the radiolucency may extend beyond the, this is cement enamel junction, beyond the cement enamel junction. Okay, beyond the cement enamel junction. Any one of the side, maybe this side, lingual side, maybe labial side, any one of the side, we can see the radiolucency. Radiolucency, it means empty space. That means tumor. with a sclerotic border. Sorry, no sclerotic border. There is a corticated border. Due to this tumor, the root may be diverse or displaced. You see in this radiographic, we can see that here you can see the root is diverse. Microscopic fissures. Microscopically, we see that central adenomatoid odontogenic tumor is soft, roughly spherical mass with a distinct fibrous capsule. That means this capsule form of fibers. We see the figure. This is central adenomatoid odontogenic tumor, soft and roughly spherical mass, fibrous capsule. That means the form of fibers. Under cross section, the tumor exhibit white to tan. Tan means yellowish brown color. After sectioning the tumor, you can find solid or crumbly tissue inside this tumor. Crumbly tissue, that means when you crumble a paper, the paper will take a form or a structure. That's like or that's a structure of tissue present inside this tumor. You can see here there may be more than one cystic species of varying sizes. Means we found that earlier, that is it's may be white or tan means yellowish brown color. Okay, there may be one to several cystic species. Okay, like this cystic species. Okay, this cystic species contains different types of material. Okay, we will discuss about it. Some material are yellowish brown fluid or semi fluid material. Next, fine hard or gritty granular material, and also one to several larger calcified masses. These three types of masses or material may be present in the cystic species. In one species may be present yellowish brown semi solid or fluid material may be present. Here fine or hard or gritty or granular material also present in cyst. Fine means smooth, small particles, and hard and gritty. Gritty means you can relate to this term with like sand, silky, or even you can relate this word to the plaster after dry. ग्रिटी एक्चुअली कंकर की तरह है, जब कंकर है उसकी तरह है ग्रिटी. और ग्रेनुलर, यू नो दैट व्हाट इज द ग्रेनुलर. Another mass present is calcified mass. This larger calcified mass. There are three different types of material present. One is yellowish brown semi-solid or fluid material. Another fine hard or gritty granular material. Other calcified mass. These three types of material are present in one cyst. There are one to several cystic species present in one tumor. Okay, there may be crown embedded into the solid tumor or projecting into the cystic cavity. Suppose this is tumor and crown inside this cyst or tumor. Okay, crown may projecting into this tumor or cystic species. Now histologic features of this tumor. tumor is made up of a multinodular proliferation of the spindle, cuboidal, or columnar cells in the pattern comprising cells forming nest or rosette-like structure. That means spindle cells and cuboidal cells, columnar cells undergo multinodular proliferation, and these three types of cells comprises in the form of nest or rosette-like structure. That means this like a structure. This is a cuboidal cell, and when cuboidal comprises the tissue, this is a cuboid. This structure take form in a spindle cell. This is like a spindle cell. A spindle, more spindle cells comprises into tissue when this is like a structure form, and this is the columnar cells. When both three are comprising after multinodular proliferation forms rosette-like structure in adenomatoid odontogenic tumor. This is the rosette-like structure comprising the spindle, columnar, and cuboidal cells, histologically seen in the adenomatoid odontogenic tumor. Okay, a spindle, columnar, and cuboidal cells after multinodular formation. Columnar and cuboidal cells after multinodular proliferation comprising form this structure. Important point of the rosette-like structure is that this rosette-like structure is surrounded by eosinophilic membrane. This is the eosinophilic membrane. That means we discussed that there are many rosette-like structure or nodular duct-like structure are present in the tumor. This is this nodular structure, cellulose nodule. Between the cellulose nodules there are tissue, and these tissue are formed of stellate reticulum cells. This is stellate reticulum is dominate in the tissue that between the nodular structure. Okay. The most distinct features of adenomatoid odontogenic tumor is duct-like structure. This is duct-like structure, and this is duct-like structure have lumina of varying sizes, maybe large size, maybe small size, maybe medium size, and this lumen is surrounded by a layer of cuboidal cells or columnar cells, where the nuclei are polarized away from the lumen. That means polarized away from the lumen. That means this side. Okay, this is a cuboidal cell. Okay, cuboidal cell, cuboidal cell, cuboidal cell is like, and cell nuclei not in this position. Nuclei are in this position present. That means polarized away from the lumen. These duct-like structure are surrounded by a eosinophilic membrane. This is eosinophilic membrane. Okay, this eosinophilic membrane also called as a hyaline ring. The most distinct features of AOT, that means adenomatoid odontogenic tumor, a scattered duct-like structure. These structures have lumina of varying sizes that line by single layer of cuboidal to columnar cells, and nuclei are polarized away from the lumen, and this duct-like or microcyst lumina lined by eosinophilic rim of varying thickness called as a hyaline ring. Stellate reticulum cells also present in the tissue between the cellulose nodules. Means a star-like structure, like this is a star-like structure, or maybe star-like structure. This like structure is formed in the tissue between the Cellulose nodules. Leafy gang rings may be seen in the parenchyma or stromal zones of the tumor. We earlier found in squamous odontogenic tumor these rings. What is this ring? We know. We discussed in the squamous odontogenic tumor. That means lazy gangs we already found in two tumor. One is squamous odontogenic tumor and another is adenomatoid odontogenic tumor. Yes, conservative surgical excision is the treatment of this tumor, but recurrence is rare. Now, what is the conservative excision or conservative surgical excision? That this is suppose is a tumor. We remove this tumor along with surrounding skin, a small amount of skin. We remove this so that no persistence of this tumor in this area. Okay. Note: dangerous cyst may be transferred into the AOT, adenomatoid odontogenic tumor. That means dangerous cyst adenomatoid odontogenic tumor में भी कन्वर्ट हो सकता है.